Have you ever heard of ultrasound guided neurofascial hydrodissection? I didn't think so, but I've done a lot of shows on stem cells and PRP, and I even just recently did one on ozone. Well, put it all together, and you have this concept way cheaper. Matter of fact, I used to say prolosome is where you start before you go to stem cells. Well, this is where you start. Honestly, this inexpensive therapy can change your world, from chronic pain to neuropathies to headache. I mean, so many things we discuss on this show. And I learned a ton, and we get to see the doctor who is teaching us inject himself on ultrasound, literally live. So you're going to get to see that on the show. But look, I think this is an amazing answer. I don't know what you know about fascia, but it is a cause of a lot of health problems, a lot of chronic pain, and something so simple is freeing up the nerve from the fascia around it. And wait till you see how easy it is. But this is a show. You're going to want to share a lot of this show, but stay tuned for this episode of Cell TV.
Hello, everyone. Welcome to Cellular Healing TV. I'm Ashley Smith. And today we are welcoming Dr. Phil Lenoue III, who is an osteopathic physician whose passion is to help patients regain their function and quality of life. And an important part of his mission is to teach other healthcare practitioners how to perform diagnostic ultrasounds and ultrasound-guided injections. And stay tuned for a live demo later on in the interview. You're not going to want to miss it. You are really going to enjoy this. So I will let you two take it from here. So let's welcome Dr. Phil and, of course, Dr. Pompa. Welcome.
Awesome.
Thank you, Ashley.
Yeah, Dr. Phil. That just seems to roll off for some reason. I wonder why.
Not the first time I've heard that.
Yeah, exactly. Yeah, and I have never put the third after your name, so that was the first for me.
Yes, I've had some good fills in front of me.
Yeah, absolutely. Well, let's tell our audience that you and I have known each other now for probably
over a year now. Yeah,
over a year.
I think just over a year.
Yeah, because Phil is like me. He seeks out his own experimentation and his own health. And Phil, you were a client of mine who just probably saw Cell TV and was like, Cellular Detox, that's what I need. That's why my brain's not shutting off, because I remember when I first spoke to you, it was brain fog, lack of energy, all the things that I would say most people say, gosh, that's what I have. I mean, kind of let's reflect back on that, because we have done a lot together.
Yes. So after residency, I just noticed that I finished residency. There was some transition. I was working urgent care, working a lot, at my new job, at my private practice, kind of stretching myself a little bit more thin. And I noticed over the next several months, like my brain just wasn't firing the way it used to. I noticed that, especially if I ate gluten, where before gluten never bothered me. I noticed if I had a beer, it would affect me for 2 weeks, I felt like. And I felt like my body was not functioning the way it used to. And then fast forward, I kind of kept dealing with this, and I was like, okay, how can I help myself? And so I was like, well, I'll give up gluten. And that actually helped some, but it wasn't the whole thing. And then so after kind of dealing with this for a few years, one of my buddies, Sam Lavis, he who's an osteopathic, he's in residency now, so he's an osteopathic physician as well, one of the good friends of mine. But anyways, he was like, have you heard of Dr. Pompa? He's amazing. And he told me about some of the things that you do. And then me just naturally being curious, I was like, oh, I need to Google Dr. Pompa. And then I read your story, and I was like, that sounds like me. And I was like, I want to work with him, because I like to work with the best.
Yeah.
And so,
and like me, your first symptoms started, when you first came here, it was 3 years ago. So now maybe over 4 years ago, maybe even closer to 5. Yeah. But it started after you got amalgams out, just like me. Am I right on that?
Yeah, that's right. I was so excited. I was like, I need to get this metal out, because I knew it wasn't good for me. I didn't know that much else about it. And so it was just over the course of several months after that that I really started noticing. I'm like, what is going on with my brain? Like, I well, I couldn't be present. I would be okay if I was in a fasting state, but a lot of times when I ate, I just did not feel good, and a lot of foods just didn't settle well with me anymore. And I kind of eventually got to the breaking point where I'm like, this is not okay for my wife, my kids, my family, my friends, my patients. I was like, I need better energy, so I was like, I need help, and luckily,
Yeah.
I've been blessed to be connected with you.
Well, I always say, look, we all need a coach. It's like I always say, if I got sick again, I'd hire one of the darn doctors I train just so I could not, have to be stuck in emotional thinking all the time.
Yeah, because it does that thinking is powerful.
Exactly. It's like, I don't want to be there, man. You did the right thing. Trust me. And then you also, like myself, ironically enough, later had a mold exposure, which of course then you really reacted. So tell a little bit about
Yeah,
that.
so I ended up having mold exposure, and I probably had some mold exposure growing up in college and everything like that. And then I ended up having mold exposure. And for an example, we moved into this new house, and within a month of moving in, we found a mushroom on the carpet growing. And then we found a puddle in the basement. And so then we found that there was 3 stories of water damage in one side of the house. And then one of our whole sliders, the way they formed the cement, the water would actually flow back into the house, and there was no gutters. And so once they ripped open the walls, there was like, surprise, and there was some black mold. And obviously I realized that didn't really help my situation at the time.
Yeah, no. Look, and I say, metals, mold, and hidden infections are the 3 big neurotoxins where people just lose their lives, even healthy people like you. And then you had 3 root canals, as I recall, cavitation, got a
Yeah.
cone beam done.
Correct. So I actually went to, this is a good lesson for the listeners too. I went to a doctor in town who did a 3D cone beam, but he wasn't trained on how to read them properly. So he said that I looked fine. And then I talked with Dr. Pompa, and he was like, you need to go to a guy that knows what he's talking about. And I was like, all right, well, I'll go over to Seattle. So I went over to Seattle, saw Dr. Panaport, and he found I had 6 cavitations. And I was like, okay, that makes sense why I'm not feeling too hot nowadays. So I've already had 4 of them done. I'm waiting to get my last 2 done. And actually, I'm kind of doing a specific test right now to see if I can heal them with doing enough 10-pass ozone treatments on my blood before I repeat. But anyways, I'm in the process of healing, and each cavitation that I've had fixed has made a huge difference in my overall health. Yeah. 2 of them were also parasites. The cultures came back as parasites.
Yeah, right. With the DNA test, where literally they're taking the infections, which I love to do, and see what's in you. And of course, there was bacteria, anaerobic bacteria, but parasites as well.
Yep, all from Honduras back in 2015 when I went there to train for prolotherapy. So very, very grateful that I got connected with the right people for that.
And here's the thing with that, right? It's like, how many people, Doc, would be chasing they're trying to get their microbiome right, trying to kill parasites, and meanwhile they're harvesting in places and hidden infections in the oral cavity. I mean, imagine.
Yeah, I see it all the time, and I see all these people with weird symptoms, and I have them open their mouth and they have like 10 amalgam fillings, and I tell them, you need to get that taken care of immediately, but make sure there's a dentist with proper protocols and don't do too much at once. All the things that you teach. So hopefully I can help guide them through the detox side of that as they go. But I think a lot of people don't understand how truly important it is to have good mouth health.
Yeah, I can tell you that for sure. And you're still doing brain phases, I'm sure.
Yeah, I love them.
Yeah, yeah, no doubt. Yeah, I mean, it's so true. I mean, people get their amalgams out. Even in 25 years, they have brain fog and their brain's not working. That inorganic mercury is still trapped in the brain until you do something about it. And then you get these other exposures like root canals, mold exposures. It's this evil triad, man, that just steals people's lives and they don't know.
Yeah, it's pretty powerful stuff, what you teach. So I'm very grateful to your
All right.
recipient.
Well, let's talk about what you're doing there, because it's one of the reasons why I was so motivated to get your brain back, because you're doing great work, man. Including let's start with the ozone. Why not? Because I just on episode 285, I talked about ozone, and so many people wrote in, well, where can I get these 10 pass ozones? We talked a lot about the high powered ozone and pulling out the blood, pushing it back in. That's what 10 P is. You can give them a little review and then talk about some of the things in your office that you're doing this ozone for.
Yeah. So I've been doing ozone for about 2.5 years right now. And initially, I was exposed to ozone by actually a family friend, John Stockton, who's obviously one of the best all-time basketball players. Super nice guy. But anyways, I'm so grateful, because then I spent some time with Dr. Jason West down in Pocatello, Idaho.
I love Jason. I was just with Jason a few weeks ago.
Yeah, great guy. And then I ended up last May, I went to a conference with Dr. Schallenberger, who's kind of the godfather of ozone in the United States. He's been doing it for years. And so once I went to that course, I started doing a lot more systemic ozone, such as, rectal ozone for liver function, just ozone topically, limb bagging for infections. You can use ozone oil for different, skin ailments. The main thing we use it for,
just
though,
so people know, if you don't know what those things are that Doc just mentioned, episode 285, we talked all about all of those things, and now you have a place to actually go to get it done. So go ahead, Doc.
Correct. And so the main use we have for ozone, because we primarily treat musculoskeletal injuries here, and now we're getting more into the detox, anti-aging side of things, is for musculoskeletal injuries. So for example, somebody comes in, they tweak their knee, they're like, oh man, my knee's hurting me. What we do, what makes us different, is that we're trained in diagnostic ultrasound. So we're able to actually, in combination sometimes with MRI and or X-ray, we are able to diagnose their knee with diagnostic ultrasound. And so sometimes we'll actually pick up, other tears and maybe their patellar tendon or their MCL that sometimes even the MRI miss. And so by doing that, we'll be able to get a more holistic picture of exactly what's going on with the patient, what the injury is, and how we can actually help them. So then what we do is we use ultrasound guided injections, right, to guide the needle right exactly where the injury was. And then we inject it typically with the procaine solution, or we'll use stem cells, placental tissue matrix, PRP. We have a lot of different concoctions that we need to use, or we can use, depending on what the patient wants, how quick we want to get them better. But then what we do at the end, we add on the ozone. And the ozone just gives more horsepower for whatever we're using.
Yeah.
So, for example, Hoop Fest, I played a 3-on-3 tournament, tweaked my right knee and injected my knee with ozone the next day, it was actually, and then immediately felt better within 2 days. So I've seen some phenomenal results with it.
Yeah, my ozone machine staying right over there. I was just telling you a story how I used it yesterday. It's like I use that thing constantly. I just ozone is amazing. But the 10 pass, man, I mean, this is how you really push. I mean, you're taking out your blood, you're basically mixing it and putting it back in 10 times, right? I mean, that's the whole 10 pass. But what that does for your immune system is just amazing in general.
Yeah. So Dr. Lahotny is one of the physicians over in Austria who has the most experience using the 10 pass. And he's been doing it for, I think, at least 5 years. And so at his clinic, that's mainly what they do. They treat people with 10 pass. So he'll have these people that have these non-healing ulcers, chronic infections, and some of these patients get better within 48 hours. For people that are a little bit more chronic, such as people with Lyme, MS, Parkinson's, he's actually had really good outcomes with a lot of these patients. With ongoing treatment. So these people that have more chronic conditions such as Lyme, or any kind of like Epstein-Barr, chronic viral infections, they typically need more like 10 to 20 treatments. But some of these responses and some of these cases are just miraculous, how much better they get improved. And what it does is it balances out your immune function, and it upregulates what he's found from what he's done, upregulates and activates your stem cell production, and then also upregulates and activates your mitochondrial function, which are all great things.
Yeah, which when I get it done, I feel amazing for days on end. So obviously it benefits the healthy person or someone struggling, to your point. All right, well, you do a whole heck of a lot more. Tell us about the ultrasound guided neurofascial, basically therapies that you are hydrodissection, as you call it, as well.
Yeah, so this is kind of a term that kind of combination of Dr. Stan Lamb out of Hong Kong, Dr. Tom Clark, who's kind of all of our teachers, who's a guru at ultrasound, excellent skills, and one of my colleagues who has taught me a lot, Dr. Sean Tierney. Kind of a backdrop before we kind of go into that. I'm part of an organization called MSKUS, which is an organization that helps teach physicians, other care providers, how to do ultrasound guided injections, how to do diagnostic ultrasound. And they're largely the reason why I know how to do this. And I'm very grateful for all they've taught me. And so what ultrasound guided neurofascial hydrodissection is we're actually finding where nerves actually get trapped by the connective tissue from a trauma, repetitive use. There's numerous different things that can happen with that. And so what happens is with the ultrasound, we're able to actually see where that nerve's being compressed, and we're able to guide a needle very specifically and precisely right above and below. And what we do is it's called hydrodissection because we're actually using fluid to dissect out those fascial planes, both above and below. So we create this space, this halo, we call it, over the nerve. And then we're able to scan up and down the nerve to make sure that halo is complete. So it works great for things like carpal tunnel syndrome, any sort of nerve entrapment, lots of neck pain, people that have neuromas. I mean, they're endless. I know we'll talk more about the different indications within this talk, but I've been amazed at some of the outcomes. For example, we just had a patient today who was in a really bad rear end car accident. She ended up hurting her whole left brachial plexus, upper thoracic spine, lower cervical spine. And now she's a NICU nurse, and she has a difficulty gripping her fingers. And so today I tested her, and she was probably 4+, 4 out of 5 strength. And so she couldn't quite hold those fingers strong all the way tight. So what we did is we ultrasound guided hydrodissected her brachial plexus up in her neck. We came down and we found that one of her painful spots is where her median nerve, which is the nerve that allows you to grip, at her elbow was hurting and inflamed on ultrasound. And then also there's another spot at the pronator tunnel that were all inflamed. So what we did is we ultrasound guided, we hydrodissected brachial plexus first. Her grip was still about the same. Then we ultrasound guided and hydrodissected the brachial or the median nerve at the elbow, and immediately she had 5 out of 5 strength, like no change at all, no differences side to side. And then we just because I thought she needed it, we also did it at the pronator tunnel. So being able to use the very specific and precise ultrasound to guide that needle right where that nerve entrapment is, you can get some phenomenal results with patients.
Wow. How long has it been around? I mean,
it hasn't been around really long, and I'm pretty sure Dr. Clark is the one that kind of started it. Mm-hmm. So knowing him, he probably started dabbling like 20 years ago. But as far as I would say only the last 5, maybe 10 years, it started to become more popular because people are realizing how valuable it is and how well it works and how few side effects. I think one of the coolest things is that the injectate that we typically use, so the solution we typically inject, is 5% dextrose, which is very benign. It's not like steroids. It's very safe. It's very affordable as well. And so I think that's one of the things that makes it a very valuable treatment, is that you can start with 5% dextrose, and then eventually you can go up to PRP or exosomes or things like that if needed.
Yeah, so it's inexpensive. It's a great place for people to start. Like you said, instead of jumping right into stem cells, or exosomes, can it be used for other things besides neuropathies and nerve-related things? I mean, can it just be used for arthritis? Can it be, what else are you using it for?
Yeah, that's a great question. So we have several patients who they're scheduled our hope is they don't have to have knee replacement surgery, but that are scheduled for knee replacement. They said, hey, can you just help me like for 6 months get through this? And what we'll do is we'll do ultrasound guided hydrodissection along the nerves of the medial aspect of their knee. Because what happens is that those nerves along the inside of your knee, they actually get stuck on those bone spurs. And so those bone spurs are actually irritating those nerves. So what we do is we go and actually dissect off those nerves and kind of create those fascial planes, create space. And a lot of times they'll get up the table immediately and say, oh, that feels so much better. And sometimes they don't need any surgery because you're taking care of their pain, even though their knee might still might not look, amazing. And so we use it a lot of times in combination with, the different like stem cell based treatments or, PRP regenerative treatments, just because it's a really important adjunct. And I have had some patients who have had, regenerative treatments that they're not actually responding as well as far as the pain. And what they've been missing is the hydrodissection. And so I think that's a very, very crucial, important part of the actual, diagnosis and treatment of all these musculoskeletal problems.
Yeah, that's interesting, because now, okay, so fascia, it lays under our skin against our muscle, right? It's like the turkey, that you take the skin off the turkey, that like gelatinous connective tissue underneath there, just so people understand that this fascia. Can you use it just for because I know that fascia after injuries becomes a problem. I mean, can you do it with just the fascia on the muscle as well?
Yeah, so that's why we call it neurofascial hydrodissection, because in some cases we're actually specifically going right around the nerve. And a lot of times you have these little sensory nerves that you can't even see within the connective tissue. So let's say that somebody had a trauma where, let's say a chair or a table fell on a leg. And what happens is they have direct tissue trauma to that area. So what you do is you actually guide the needle underneath that tissue and you separate out those fascial planes where that trauma has occurred. And an example for you would be a patient we had today who has had a hip replacement surgery and has this huge scar on his lateral thigh, so the outside of his thigh. And he came in just had horrible hip pain since his surgery. So after 3 treatments, he's already doing significantly better. He gets off the table and you could tell how much more comfortable he is, just because we're able to actually guide the needle right where that scar tissue is, and we break that up. And then the cool thing is that we also do, because we're trained in using ozone, is that after we hydrodissect, a lot of times what I've been doing recently is like adding low concentration ozone, and I've been seeing some amazing results with people and nerve regeneration, helping strength, helping get rid of tingling. But yeah, it's a great combo.
Yeah, I know. I mean, when people get their scars injected just with Procaine, I mean, they go, oh my gosh, it like transform. Could that be part of the reason is you are separating that fascia off of the scar?
Correct. Yeah. And that's what I found. I had a patient who, I like to use patient examples because I feel like they paint a better picture. I had a patient for about 10 years after she had a lumbar fusion. She had this lower abdominal scar, and she had lymphedema or swelling of her lower extremities, more so on the left side. After 2 treatments, and all I did is I went deep into her scar tissue, up in her lower abdominal region, and injected 5% dextrose. And I believe I used a little bit of ozone there. After 2 treatments, 85% improvement in her lymphedema that she's had for years. And she's been to like the best therapist. She's tried everything she could use. And so I think it just shows you a lot of times the scar tissue and these fascial adhesions actually are affecting the lymphatic flow and just your neurovascular system as a whole.
I couldn't agree more. And, how does there's neurotherapy. I don't know how many people are familiar with that. How does this differ from that where, I mean, I've had it done myself, right? Where the stella ganglia has been injected, the crown of thorns, that's called neurotherapy. How does this differ? And
yeah, so that's a great question. In some ways they overlap a lot. For example, if I'm injecting a scar, I'm using very similar neurotherapy techniques. Yeah. And for those of you who don't know, neurotherapy is, I believe it was from Germany, is where you inject scar tissue with Procaine, and it helps reset the nervous system so that your acupuncture meridians and everything flow and you feel much better. So the nice thing is about ultrasound is you can be a lot more specific. So rather than saying like, hey, if somebody comes in and they say, oh, my head just hurts along here, neurotherapy, classically, you would just say, oh, does it hurt here? And just kind of map out with just your feel. For ultrasound guided hydrodissection, you can actually see or feel where the actual cervical plexus, where the greater auricular nerve that comes up over your ear comes from, your lesser occipital nerve, your supraclavicular nerve, they all come out of the side of your neck. So what we'll do is, rather than hitting all these spots here and here, a lot of times with just one spot, you can actually knock out all the pain to all those nerves immediately.
Yeah. Wow. That's incredible. Yeah, I can see that as a huge benefit. You know, like you said, I mean, I've even had people after stem cells still have, you know, what they describe as maybe just stiffness. It may be that, right? I mean, it may be that they just need that released like that.
Yeah, because there's a lot of, you know, good physicians, you know, doing this kind of treatment, like as far as stem cell therapy. But I think a very important part is like, let's think about the nerves. And so something that we've learned at our clinic, because we have a few other practitioners that work with me, Dr. Pasma and Dr. Mako Yoshino, who's going to join us. Both of them are both DOs. We're all trained in doing this type of treatment, the hydrodissection, is that we've just learned that being able to think about the nerves that are associated with the joint you're treating, and then looking at those on ultrasound. For example, if somebody sprains their ankle, like an inversion sprain where they roll it kind of going inside, so the outside of their ankle hurts, there's actually a nerve that comes right over that ankle joint that is often irritated. And so what happens is these patients come in and their swelling might be gone, but they're still like, oh man, my ankle still hurts. A lot of times with those patients, it's one treatment and they're happy. They don't hurt anymore. They get their proprioception back right away. Sometimes you actually have to treat the ankle joint as well, depending on what it looks like and the stability. But it's pretty phenomenal when you start incorporating this into your practice and how much better patients.
Yeah, man. What you said, the proprioception gets better because, you know, that's that communication that you just kind of, your brain knows that something's not right biomechanically, still even know the tissues are better, the stem cells may have made a big difference or whatever treatment you did. So, okay, I mean, I used to say that, hey, start with prolozone, go to PRP and then stem cells, you know, I mean, you know, kind of like, okay, it's cheaper here and it gets more expensive, you know, and if this doesn't work, go to this, if this doesn't work, go to this. Well, I mean, this is kind of like perhaps the first and the last thing that you may want to do.
Yeah, exactly. And I think that's why it's important to, you know, when you're seeing whatever practitioner is you're seeing, make sure you feel comfortable with them. I know with us, we have a unique skill set because we're trained as DO, so we're all trained in doing manipulation in combination, you know, to doing the ultrasound diagnostics and the ultrasound guided injections. But a lot of times, if you can just really get a good idea of what exactly the diagnosis is, you can get a way different treatment outcome, and a lot of times save people a lot of money too. I have no problem, you know, using stem cells or exosomes or, you know, placental tissue matrix or PRP. They're all great things. And if people want to get, you know, results really fast, sometimes that's the quickest way to do it. But for some people, you know, after a proper exam, you're just like, hey, you might just need hydrodissection. I'll give you another example. So I had a guy, I think about 42-year-old, comes in with bilateral low back pain for years, I think like 10, 15 years. And he was about to go on a trip. First time I met him, we had a mutual chiropractic friend who set us up. And so I told him, I was like, hey, I know you just met me, but I really think I can help you with your back pain. And so what we ended up, I'm going to bring a bottle up for those of you watching. This is the back of the pelvis. And so this is the iliac crest right here, which is kind of like your pelvic bone on the back that kind of sticks out. And so he had pain right here and right here. On either side of where the pelvis sticks out on the backside. So there's nerves right there called the superior cluneal nerves that run right along there. And a lot of times they get caught in that fascia or dense connective tissue. Sometimes it can be from trauma. It can be from repetitive overuse. So all we did is we using ultrasound guided guidance, we put the needle right along there and actually separated where that nerve was getting trapped. We did it on both sides. Other than initial numbing poke and a little bit of deeper numbing, he didn't really feel much. Got up immediately and said, hey, it felt great. And I said, all right, let's just see how you do, you know, because the numbing's in at that point. So you don't know long-term how he's going to do. So he came back 6 weeks later, and the first thing he asked me is if he could hug me, because his pain was minimal since we did that injection. So that's just a small example of, with proper diagnosis and proper use of this, you can get some amazing results. And sometimes these patients, that have tried different regenerative things haven't quite worked. It might just be a, neurofascial kind of adhesion problem. They just need some of this treatment.
Yeah, I mean, my son broke his back. Most people watching this have probably been following that. But, I'm thinking about that, right? It's like we're doing all these amazing things. However, a lot of that trauma obviously could really affect his fascia, which would show up later, and entrap a lot of nerves. My gosh, I mean, the amount of trauma. So this is something I want to get done for him.
Yeah, definitely. A common thing I also see is people that have this kind of, they call it quadratus lumborum pain, or like just the side of their low back pain. And sometimes they'll say it hurts in the front of their hip. So what we do is we actually, we go in through the side, right underneath, deep to that quadratus lumborum muscle, between that muscle and the iliopsoas, your hip flexor muscle.
Right.
And we actually push a bunch of fluid into where your lumbar plexus comes out. And what happens is that actually helps that pain on the back. And then it also helps all that tension to the front. So a lot of these patients with tight hip flexors, immediately they'll feel increased motion through that hip flexor.
Yeah, that's amazing, dude. Like I said, I mean, I think this is where you start. Spokane, Washington, right? I mean, we'll make sure just give people your website, your information. We'll put it on the screen here and in the show notes as well. But give them your information. I know a lot of people are going to want to come see you.
Yeah, it'd be great. We'd love to help them out.
Yeah. So what's your website? Give me your.
Oh, our website is www.LenouxIntegrativeMedicine.com. And right now we're in the works of kind of revamping it at the moment. So you might get the older one or the newer one, depending on the week.
All right. We'll put up a link here for our folks. And I don't know, is there a way for them even to call your office and say, hey, can you help this before? Because a lot of people.
We have on our website right now, we have a link to Podium. So it's instant messaging. So, and a lot of times I'm the one checking that. So what you can do is you can write a little message in that little box that pulls up in the corner and just say, hey, can you help us with this problem? Is this something that you would treat? If you're not quite sure whether or not we can help you. But it's amazing how many patients you can truly help once you start actually looking into these fascial adhesions and, nerve problems. And we've had several patients I had one patient who was scheduled for carpal tunnel surgery, looked us up online. We ended up doing the hydrodissection. A month later, the actual area of her median nerve, which is the nerve that's affected in carpal tunnel, had regulated back to normal size, and her symptoms were significantly improved. So we did one more treatment. After 2 treatments, she was good. So it's really nice to have a different option, for people that are like, on the fence for surgery. And the nice thing is there's no downtime.
Yeah,
so
totally.
If you're somebody that doesn't want to take off work and you want to keep your function, it's a great way to go.
How far are you from the airport? Because I know a lot of people fly.
We're probably about, I'd say 10 to 15 minutes. We're pretty close to the airport.
Oh,
we're right in the Gonzaga University neighborhood. Go Zags.
Yeah, I know nothing about that. However, 10 to 15 minutes from the airport, that's like, I tell you what, I'm going to come get evaluated myself. I helped you, now you're going to have to help me.
Yeah, I love it.
I just want to learn, honestly, for me at this point. I just like to see it. All right, with that said, I want to see it. You promised and you're going to show us something.
So now, for those of you who are not watching, we're going to actually do a little demonstration. I'm going to hydrodissect my superficial peroneal nerve, which is on the outside of your leg. That often can be affected from ankle sprains. So I had some ankle sprains when I was younger. My superficial peroneal nerve is much improved, but I might as well treat it.
Let me ask you something on that note, right? My one son, Isaac, I've tried everything. He has massively pronated feet, right? And we put stem cells and exosomes, PRP, and we started, and he has this constant, jumper's knee, right? Where the pain right under the patella, and nothing holds because his darn feet are pronated. Could he have some entrapped nerves that, or fascia that?
Yeah, he might have. It might be his tibial nerve and his tarsal tunnel. That might be something that's entrapped there. There's different things that can be going on. Because sometimes when you have nerve entrapment, it just affects, like we talked about, the proprioception. So if you can't, if those muscles don't fire properly, you know, you can't have a normal gait, normal function. A lot of times, immediately patients will regain that.
Yeah, I'm curious about that. I'm gonna have to have them, you look at them. But all right, I can't wait to see this.
All right.
Okay.
Sorry about that.
Sorry, you're literally multitasking massively right now. I'm pretty impressed. You're not a woman, so it's really impressive, actually.
Awesome. So yeah, so that definitely might be part of what's going on there. Did you still hear me?
Yeah, I can hear you. I'm just waiting to see.
All right, so
I'm waiting.
to do a demonstration now. All right, so I'm gonna put this here. This is my lovely assistant, Kaylee.
Hello.
She's my medical student right now. We take a lot of students here, so
Cool.
she's helping me.
Kaylee's waiting in the wings, ready to help. Okay, there's the ultrasound picture pretty soon.
All right, so right now, this is a picture of the ultrasound right up here. Pretty soon, you're actually gonna see my anatomy. And so let me change the setting.
Everybody loves the doctor who's willing to do his own treatments on himself. We're watching it live, folks.
Doesn't get any better than that. So what you're going to see is you're going to see the needle come in from the side. And so what I'll do is I'll actually start looking at my foot, my lower leg.
Can Kylie like scroll down and like show you where the injection is and then back up to the
yeah, let's do that. All right, so this is my leg, lower leg. So this is my ankle.
Yep.
And so superficial peroneal nerve, it branches all the way up higher, but the region where we're going to actually treat is right around here, because on me it's actually significantly better than it used to be, but I used to have a lot of swelling right here from my old injury. Mm-hmm. And so what you'll see is I'm going to have the ultrasound right here, and the needle is going to come in this way. And what you're going to see on the screen is actually that needle coming across and kind of going over that nerve. So once I pull up the image, I'll actually show you what that nerve looks like so that you can actually keep your eye on it and kind of see what I'm doing.
Oh, wow. That's awesome. Yeah, because then you know exactly where you're going and need to go. And by the way, I've had these superficial injections. I mean, you really barely feel anything. It's pretty remarkable.
Yeah, a lot of times they don't hurt much at all, which is very nice.
Yeah, which is why you can do it to yourself.
Yes, exactly. I've done some things to myself that are a little more painful, but I'm glad that this is not one of them right now. All right, so let me get some alcohol here. All right. So again, we're going to first go over the diagnostic image of what that looks like.
And so you have a little, tell what's in the solution, 5% dextrose.
Yeah, we're just using 5% dextrose today. That's it.
Okay.
And so.
And by the way, people would be like, sugar, what's that do? Okay, it's the fluid, number one, it causes the separation. Number two, it does stimulate the body into some healing, the immune system.
Yeah, so the cool thing about 5% dextrose, what it actually does is it actually resets a specific pain receptor called the TRVP1 receptor that's responsible for this like kind of achy, chronic, irritating pain. And actually sends a signal back to the spinal cord to relax all along the muscles that are along that pathway. So there's actually some really cool physiology as far as why the 5% dextrose specifically works. And on our website, we actually have a paper that from the American Academy of Orthopedic Medicine that they've created that explains some more of the physiology in detail.
That's awesome. So what are we looking at there?
All right. So yes. So right here, you can see
it's a little out of focus where it was before it was in focus. So let's see if we can.
Here, let me change the gain a little bit. Is that a little better?
That's better. Yeah.
Okay, cool. I just had to change the gain. So right here's my fibula, and you have peroneal muscles back here.
Okay, so the fibula is the small bone on the lateral.
This is the bone, yeah, on the outside of your ankle. This is your little bone on the outside. That's fibula. And then when you come across here, this is superficial tissue. So this is some subcutaneous fat and superficial fascia. And then when you come here, there's a little circle right here. And that's my superficial peroneal nerve. And it actually should not be that big. A lot of times these are a little harder to actually see. And so, but with mine, you can actually see it pretty easily. And then right here, you can see an artery down here at the bottom. And that's what's the one thing that's really nice about ultrasound is that you can actually pick up arteries. So you see, I just put on Doppler, so it actually lights up that artery. Oh. So that way you can do very high risk procedures, but do it in a very safe manner.
Yeah, so like, if you're in the upper cervical area, you can spot the carotid pretty easy.
Correct. Yeah, so if I'm doing like stellate ganglion blocks or anything like that, you know exactly where the blood flow is so that you can be very safe for the patients. And be very precise in where you're putting the solution. So right here, yes, you can see the fibula, and then right here, you can actually see the little superficial peroneal nerve. So what you're going to see is you're going to actually see the needle. I think I'm going to come from this side. So you're going to see the needle come from the left side, and then you're going to see it open up. I'm going to go below and then above those fascial planes so that you can kind of see that actual hydrodissection.
Can't wait. This is fun.
Any questions? Any questions before we start?
No, I'm like excited. This is fun stuff.
Right, cool. I'm excited too. Get treatment at the same time. So actually, I changed my mind. The needle's gonna be coming from the right side of the screen.
Okay.
You can move that arrow. All right. So you're gonna see. So when you're doing these injections, you got to make sure that the needle is bevel up. All right, so you can see kind of from the top right, there's a needle kind of coming through.
Yeah, I see it.
That line. And so
now you're on the top of the nerve.
Yeah, the key is to always see the tip. So I'm getting kind of, now I'm going to go into that fascial plane kind of below. And then you see how it opened up?
Oh, yeah.
So that's that nerve, that fascia surrounding that nerve opening up. So
you're putting in the fluid. That's what's opening it up.
Yeah. So the fluid opens up. That's what makes it very gentle. So it actually doesn't hurt very much because a lot of patients don't love injections. But this, out of everything we do, is the least painful. And some of the results are pretty miraculous almost immediately. Yeah. So you can see right there, I'm still kind of coming underneath it, putting extra fluid. And then I'm coming back, so you can see I can see the tip the whole time. And then what I do is I actually change, and I change to bevel up so that the fluid actually pushes down from the needle.
Oh yeah.
And so then I'm coming over the top here.
Right, now you're pushing it down.
Correct.
So you separated it off the bottom, and now you're separating it off the top.
Right. Yes, and then I can actually feel like kind of a cool sensation down into the top of my foot, because that's where that nerve goes. So you can kind of see how it's kind of creating space.
Right.
Needle. So you're kind of separating out where that needle is right there.
Right.
And you can kind of see that space right there. So then I did space above and below, and then I just pushed a little extra fluid. So then you can kind of see, you see how if I go up and down, you can see that fluid kind of surrounding that nerve now.
Yeah. Now, so, if you hit the nerve, what would you feel?
You just feel like a little tingling. So when I first started learning this stuff, I didn't have quite as much precision about like 3-4 years ago. But now I can get pretty much as close as I want to, and I hardly ever feel anything. But the worst thing you'll feel is like a little zap, but it will never cause any problems.
Yeah.
Because you're being really gentle, and like we talked about before, the fluid is what is actually creating the space for that nerve to actually function the way it was supposed to.
Right.
So something you can also do is, you can see my needle on the top. I can actually also hydrodissect some of these fascial planes that are superficial. So you can see that needle kind of coming across here, and then it just opens up some of those other planes.
Yeah. So you're kind of more on the muscular fascial, right?
Yeah. And so a lot of times we'll treat both things together.
That's smart. Yeah.
And so you can kind of see that needle kind of coming across here. It's kind of opening up those planes. And then
now,
kind of the same
they say that there's a nerve plexus that is in the fascia, even under the muscle, meaning there's at least some type of very, very small nerve that communicate with the nerve system.
Yeah, so in addition to the little nerves that are within the actual, here, I can take this back. So in addition to the little nerves that are around the fascia and in the fascia, in the subcutaneous tissue, like the fat, you also have nerves that are actually around the nerves. They're called nervorum. And so when you're actually creating space around that nerve, you're actually helping to reset those little nerves that go to the nerve. And sometimes we'll actually hydrodissect around arteries too, because there's actually sympathetic nerves around the artery. And so sometimes if, let's say there was a lot of trauma and, that in that space, that artery itself, you feel like the pulse where you had that trauma doesn't feel the same, or it's a lot harder. And so what you do is that you actually will hydrodissect around the artery. Obviously, you want to be careful so you don't make it bleed. But the fluid is what actually pushes the space, and a lot of times that will actually reset the tone of the artery. So then it'll be more like fluent kind of rhythmic pulse.
It's a simple treatment, but yet it's a big deal. I mean, because when that fascia like that, is choking life off to an area, when you free that up, I mean, it's like an adjustment, right? I mean, it just frees up the life force, into tissues where, I mean, you can put stem cells or other things, but you have to free that nerve up. You do.
Oh, it's a big deal. I had one of my patients, 34-year-old guy. He played college baseball. He had no feeling on the outside of his right thigh. It's called neuralgia parasitica for those of us in the medical field. So anyways, he couldn't feel his phone vibrate or anything on the right side for 3 years. As soon as we hydrodissected with just 5% dextrose, he immediately could feel his phone vibrate in his leg. Huh. It's just pretty amazing stuff.
Yeah, that's awesome. Well, Dr. Phil, this has been a great show. I'm telling you, you're gonna get a lot of calls, I'm sure. We'll make sure, folks, we put his number, his contact in, and Ashley will make sure that that's up on the screen, and we'll make sure it's also in the show notes. So I'm sure you're gonna get a lot of calls because there's a lot of people with a lot of different problems, and you're 10, 15 minutes from an airport, Spokane, Washington. So it's pretty easy.
Forward to help whoever we can.
Yeah. Well, listen, I appreciate you, Dr. Phil, and glad we could help each other out. It's great.
Thank you for this opportunity, and thank you for all those listening.
Absolutely.
Well, that's it for this week. We hope you enjoyed today's episode. This episode was brought to you by CytoDetox. Please check it out at buycytonow.com. We'll be back next week and every Friday at 10 a.m. Eastern. We truly appreciate your support. You can always find us at cellularhealing.tv, and please remember to spread the love by liking, subscribing, giving an iTunes review, and sharing the show with anyone you think may benefit from the information heard here. And as always, thanks for listening.